Sure. So, as you know, tumor-infiltrating lymphocytes, as we fondly call them TILs, are associated or with tumor are present in the tumor microenvironment, and they are a good indicator of what the body's response to tumor is likely to be. So that's the main interest in looking at tumor-infiltrating lymphocytes. Uh, there is some data to suggest that they are important in HER2 positive breast cancer. But as you know, the data is not as good at what we know about triple negative breast cancer, where we, amongst several others groups, have shown that A, that tumor infiltrating lymphocytes are present in triple negative breast cancer, B, that every 10% increase in lymphocytes is associated with improvement in response, and 30% is probably a good cutoff to use. So in contrast to all this data that we have in triple negative breast cancer, the data in HER2 positive disease is relatively meager. Most of the data comes from relatively small trials or that have either tested with Herceptin therapy, where there was association with pCR, while there are other studies such as TRAIN2, Trifina, Neosphere, that have looked at tumor-infiltrating lymphocytes in relation to therapy uh, to, that consisted of Trastuzumab and Pertuzumab, and these trials have failed to show any meaningful relationships. So there is somewhat of a controversy as to what exactly the role of lymphocytes were in the HER2 positive space. So the CompassHER2 trial essentially was a single-arm neoadjuvant clinical trial in which patients were registered to get Trastuzumab, Pertuzumab with physician choice of Taxane. It could be Taxol, paclitaxel, docetaxel, or even nab-paclitaxel. So the trial managed to enroll 2,175 patients. Following the registration, patients received the therapy and that's when the registration occurred. Following that, patients underwent surgery, and at the time of surgery, the question was asked is whether the patient has any residual disease. And those patients are really what we are looking at. So consent for research as well as histology slides was available on 1328 patients, which were analyzed as a part of this study.